and Dr. Anil Singh sir and Dr. Malvika Singh ma'am. So sir, congratulations once again. So basically, I would like to know your perspective behind this book. So there are few simple questions around this book and around the contents of this book. So first is basically what inspired you to write this book?
I'm working in a hospital in the Department of Transfusion Medicine with blood bank, where the blood is being utilized for the patient care. And during my observation, I had seen that the resident doctors, they are not aware of how to use the blood, how to transfer it, and how to take care of the blood after transfusion, and how to detect the transfusion reactions. So this inspired me that we should give certain guidelines to them so that they start using correctly, and there should not be any reaction to the blood or any side effect of the blood. That is the reason that this book is written for the mainly postgraduate students in surgery, medicine, gynaecology, and medicine.
Great insight behind the photo. So my next question is, what is the main focus of this book?
Main focus is the resident doctors, postgraduate students of gynecology, surgery, orthopedics, neonatologists, and blood bankers, and the undergraduate students who should learn basic about the blood banking, how to use this, and what are the alternatives can be used in if the blood is not available. So this is mainly targeting the resident doctors who are treating patients.
So it will going to help for postgraduate medical students and surgeons.
Definitely,
Yes.
definitely it will help them.
Thank you, sir. So, Dr. Anil sir, so I would like to know your perspective. How will the guidelines will going to reshape the future while the readers like postgraduate and surgeons will going to read it? How will it be going to impact? How will this guideline is going to impact?
This guideline will help them to decide at what level blood should be used, or at what level, at what time, alternatives can be used. Like in what cases if the SP level is very low, so critical levels are defined, below which only alternative left is the blood transfusion. Above critical level, they can use the medication also, but because by medication also they can improve the HP. So by doing the judicious use of blood and its component, they can give blood who truly require that.
So the impact is positive.
Yes,
Yes, sir, definitely. So my next question is, as the postgraduate student will going to buy it, okay, and the surgeons will going to read it, postgraduate students will going to read it. So, but how do you think like how this book will going to be used, basically used for teaching purpose, for teaching institutions, because they will also going to buy it in the research area also, in teaching institutions.
teaching institution, not like in teaching institution, usually undergraduate and progressive students are there, postgraduate PG students of medical fraternity and sergeant fraternity are there. So basic insight of the book is guidelines. Whatever guidelines is there, they have to follow. Like in today's era, evidence-based medicine is there. So sometimes medical legal cases also arise in after blood transfusion. So by keeping the proper record, keeping the guidelines in mind, if they will use the blood transfusion or its component, they will be safe and evidence will be there for them if any case arises.
And there is one chapter in this, rational use of blood. Rational means whether it is required or not required, which product is required, whether that kind of blood cells or platelet or test for the plasma, or is there any alternative to this product, or is there any drug available who can replace the blood. So this book guideline tell them that there is a risk with the blood, so don't use this. Instead of use these the product, and there are alternatives available who can be utilized for the patient care.
So would you like to also share something about the autologous blood transfusion?
Yeah, definitely.
Short.
See, autologous is the new term. That means your own blood using for yourself. अपना blood अपने लिए. The particular unit is collected from the patients, the routine surgery patient. Like patient going to be for hernia surgery, cholecystectomy, gallbladder removal, and the breast lump, they can donate their own blood, and we can freeze that blood for about 35 days. So on the day of surgery, that blood can be utilized for them. So that is the safest blood, because with the blood transfusion, there is a risk of HIV infection, hepatitis B, hepatitis C, malaria. So that is the risk will be eliminated if you are using your own blood. So that's it. And there are different type of autologous blood methods are there, which is written in this. One is the pre-deposit, means surgery से पहले deposit कर दिया. Then at the time of surgery, during surgery, anesthesia चल दिया, उसका blood निकाल लिया. That is replaced with the fluid. And patient is in operation theatre. At the end of the surgery, if the blood is required, same blood can be transfused. So this way we can save the blood and we can save the infection with the other type of blood transfusion. So this is the benefit of
By this way, we are going to reduce the risk basically.
Yes, reduce the risk, and we can conserve the blood also.
Great perspective. So, sir, would you like to share your conclusion remarks, like overall a short summary, conclusion kind of remarks? Sir? Would you share?
To conclude, these guidelines will help all the resident doctors. It will help ultimately to the patients. Properly blood is used.